Healthy habit. The NMC CBT MAC Test 2.
What position should you prepare the patient in preoperative for abdominal paracentesis? Lumbar postoperative patient moving and handling. What is not a sign of meconium aspiration? A suicidal patient is admitted to psychiatric facility for 3 days when suddenly show signs of cheerful and motivation. The nurse should see this as patient has a next dose for Digoxin but has a CR58. Patient is in for oxygen therapy. Adequate record keeping for a medical device will provide evidence of a doctor prescribed a dose of 9 mg of an anticoagulant for a patient being treated with thrombosis. The drug is being supplied with 3 mg tablets. How many tablets should you administer? The doctor prescribed a 25 mg of a drug to be given by injection. It is a drug dispensed in a solution of 50 mg per meter L. How many ml should you administer? The doctor prescribed an injection of 200 micrograms of drug. The stock bottle contains 1 mg per meter L. How many ml will you administer? If you witness or suspect there is a risk to the safety of people in your care and you consider there is an immediate risk of harm, you should in interpreting ECG results. If there is clear evidence of atrial disruption, this is interpreted at common signs and symptoms of hypoglycemia. Exclude select 4 common for hyperglycemia. Include safeguarding is the responsibility of normal heart rate for 1 to 2 years old. In the new observation system, what is AVUP? What bag do you place infected linen? Which one of this notifiable disease needs to be reported on national level? Patient is post-op repair of the tibia and fibula. Possible signs of compartment syndrome include Patient develop elevated temperature and pain in the loin during blood transfusion. This is indicative of what is the best position in applying eye medication. Which if the following is at a greater risk for developing coronary artery most commonly aneurysm will develop on on assessment of the abdomen of a patient with peritonitis. You would expect to find patient with gastric ulcer typically exhibit the following symptoms. Under the yellow card scheme, you must report the following. Degree of ingestion when giving subcutaneous insulin injection on a site. Where can you grasp 1 inch of tissue? A patient suffered from stroke and is unable to read and write. This is called hypoglycaemia in patient with diabetes is more likely to occur when the patients take Patients with gastrointestinal bleeding may experience acute or chronic blood loss. Your patient is experiencing hematochezia. You recognize this by the worst advice you can give to a student nurse with regards to the use of social networking sites like Facebook? It is unsafe for a spinal tap to be undertaken if the patient On physical examination of a 16-year-old female patient, you noticed partial erosion of tooth enamel and callus formation on posterior aspect of the knuckles of her hand. This is indicative of in community hospital, an elderly man approaches you and tells you that his neighbor has been stealing his money, saying, "Sometimes I give him money to buy groceries but he didn't buy groceries and he keep the money." What your best course of action? Prothrombin time is essential during anticoagulation therapy. In oral anticoagulation therapy, what is the best essential? Conditions producing orthostatic hypotension in the elderly. Water low score of 20 indicates what type of matra to use. Enteral feeding patient check patency of tube placement by a patient is assessed as lacking capacity to give consent if they are unable to proper dressing for wound care should be. You are monitoring a patient in ICU when suddenly his consciousness drops and the size one of his pupil becomes smaller. What should you do? Patient is post-op liver biopsy, which is a sign of serious complication. Enteral feeding patient checks patency of tube placement by nurses teaching patient about crutch walking, which is incorrect. What advice should you give to a patient taking allopurinol? What do you expect patient with COPD to manifest? As a nurse, what teaching should you give to a COPD patient? A relative of a patient is experiencing vomiting and diarrhea and wishes to visit her mother who is admitted. As a nurse, what would you advise to a patient's relative? For an average person from UK who has non-insulin dependent diabetes, how many servings of fruit and vegetables per day should they take?
Thank you for watching.